about that? Does it look like we're on now? Okay, ladies and gentlemen, we'll start over here again. Thank you for attending the Senate Study Bill 1125 subcommittee. We have an hour booked, so I wanted to make sure we had an opportunity for everybody to speak. The other senators have already said they don't have any opening comments, and we will invite them to at the end of the hour to have a comment or some words. I'd like to set the framework for 1125. What it does is have the Department of Human Services build a relationship, hire a vendor, do something to bring into the system for SNAP, Medicaid, other entitlements, asset verification and identification verification. None of the vendors hired would have the opportunity to deny somebody benefits. That would remain with Human Services. All we're doing is trying to make the asset verification, the identification verification, their location, try to make sure that can be done efficiently as possible and as accurately as possible. This same technology is used for everything from credit card purchases to financial verifications. It is tried and tested technology, and it would be just efficient to bring that same technology in to help our human services more efficiently handle the eligibility question so they can move on to helping the individuals who are in the program. So that is what the bill does, and I am open to all the public input we can fit into in an hour. The hand that I see up, so please raise your hand here electronically if you'd like to speak. Andy Conlin, you were the first one up.
Good morning, Mr. Chairman. Thank you to you for bringing this bill forward, and thank you for the other members of the subcommittee for giving us some time this morning. We really appreciate it. My name is Andy Conlin. I am here on behalf of the Opportunity Solution Project. We are a nonprofit, nonpartisan organization that develops federal and state policy to help more people take advantage of the American dream. Obviously, we support this bill, and we appreciate the conversation. If you would permit me, Mr. Chairman, what I'd love to do is turn my time over to my colleague, Scott Centorino, who is a leading expert in this field, who has seen both what we're doing here in Iowa and what they're doing in other states, and can talk a little bit about how this can help optimize our systems and programs here in Iowa, if you permit me.
I would be happy to do that, and if we have an expert on the other side of the issue that needs extra time, I'll give them similar time. Go ahead. What's that?
For Centorino or the...
Scott Centorino? Yes.
Thank you. And thank you, Andy, for your time as well. So yes, I'm Scott Centorino. I'm a visiting fellow with the Opportunity Solutions Project. Before that, I served as an assistant attorney general of Louisiana, where I worked with the Department of Children and Family Services, the Department of Health, and the Department of Corrections. I really appreciate the committee's time and energy putting this format together and for the opportunity here. I just want to very briefly, but very strongly encourage the members of this subcommittee to support this bill. The bulk of this bill, as you say, is data cross-checks, asset checks, real-time eligibility verification system, identity verification system. These measures go right to the heart of program integrity in food stamps. And look, I'll speak as candidly as I can. This is a real problem for Iowa. The improper payment rate in Iowa is almost 12.5%. And that's about 5 points higher than the national average. And that's actually higher than every single neighboring state around Iowa. Just for comparison's sake, Iowa's rate of 12.5% improper payment rate it's more than twice as high as the rates of Nebraska, the rate of Wisconsin, Missouri, and South Dakota. And it's happening for a reason. It's not just by accident. I've seen the same thing play out in state after state, and it's pretty common sense. Turns out the less you look for waste and fraud and welfare, the less you'll find. Again, pretty common sense. But if I may, I just want to highlight two pieces of this bill in particular. First, it mandates an asset check for all food stamp applicants, and Iowa has not been doing that. It has been using the broad-based categorical eligibility loophole, the BBCE loophole. And just by closing that one loophole and following federal guidelines, following federal law, you'll make sure that people on food stamps are actually eligible for their benefits. You'll see enrollment decline by a little bit over 50,000 people in Iowa. And just to be clear, this is about removing the ineligible so that the eligible can be protected. And that's what this bill does in section after section. Again, second and last piece I'll mention just here briefly is the child support cooperation requirement. In Iowa specifically, there are about 60,000 single parent families on food stamps. And of those 60,000, only about 30% receive any child support at all. This bill will begin to fix that. Michigan has used this reform for decades, this requirement. Wisconsin and South Dakota do it. And Kansas does it. Kansas saw, when they implemented it, they saw their collections go up by almost 40%. And starting this year, Nebraska is doing it as well. So this bill will help Iowa catch up on a pretty critical issue of supporting single moms in a hard time. So overall, I'll just finish by saying this bill features a number of really big steps forward for Iowa. I strongly encourage the members of the subcommittee to support it. And of course, I thank you very much for your time. I'm happy to take any questions that may arise. Thank
you very much. I do appreciate that. That was well done. A lot of information in 2 minutes and 50 seconds. That was just perfect. Thank you. We're going to move on to the next one, but please continue until the end of the hour so you could be available if you would. It looks like Carrie Malone, you're next.
Good morning. My name is Janae Harvey, and I'm filling in for Carrie, but I am a representative of DHS, and I will take approximately 3 minutes, just like Scott.
Perfect.
So our understanding is this bill requires either the establishment of a computer system or a contract with a third party to obtain income, asset, and identity verification for applicants and recipients in real time. The bill outlines data sources that would be required to be checked to verify income, asset, and identity verification at application, annual renewal, and periodically between eligibility redeterminations in an effort to deter waste, fraud, and abuse of the public assistance programs administered by the department. DHS joins with legislators that want to ensure that only eligible people receive the right amount of assistance as efficiently as possible. In order to best explain how DHS is meaningfully engaged in these activities already, there is important background information and requirements from the federal level that this subcommittee, we hope, would understand. The first is as it pertains to NAC, that's NAC, which stands for the National Accuracy Clearinghouse. This is a consortium of 5 states that used a USDA FNS grant to develop a searchable database to check pre-issuance eligibility. Those states that participated are Alabama, Florida, Georgia, Louisiana, and Mississippi. The NAC pilot ran from 2014 to 2015. The December 2018 federal farm bill mandates that all states must participate in NAC by December 2021. So this includes Iowa. FNS has been clear that joining NAC prior to the issuance of the final rules that they're developing is a risk for states, as the final rules may not mirror what NAC is today. It has been confirmed that a new NAC system and product is being produced by FNS. While we know the current model will not be used, a new product will be available in Iowa, like all states will be using it. Once the NAC product is available, it will not need to be purchased by Iowa. We only need to sign a data sharing agreement. All states are in the same holding pattern until FNS completes the work. DHS has volunteered with FNS to participate in the next phase of the NAC that will begin in spring 2021. Benefits of participating in the next round include early access to the projected cost savings and labor system efficiencies from NAC, and we will be working closely with the contractor who will be involved in building the system. The other thing we would like the subcommittee to know is that we are currently meeting with Equifax as they have proposed providing DHS a free 1-year trial of their income verification product for a pilot project. Our IT leadership has had meetings with Equifax leadership, and we're in the process of determining the system design alterations that will be needed to test the effectiveness of their system. In pursuing this opportunity, DHS would be certain to collect robust data that would help us calculate the return on investment involved in trying out their product. It must be noted that DHS has experience with purchasing income verification from a third-party vendor previously. That contract was initiated in 2015 and was supposed to be a 6-year contract. After 4 years, the total amount allotted in that contract had already been spent. While the income verification products are more sophisticated today and have access to more data sources than they did 5 years ago, legislators should be aware that the cost of this contract was not offset by a savings achieved through the promise of income verification services. When the contract ended, we did not see a change in our data on clients served or supports provided. The last area, and Scott spoke directly to this, is as it pertains to the child support enforcement as it's currently written in this bill, an applicant for SNAP benefits shall be required to cooperate with the Child Support Recovery Unit as a condition of eligibility for food assistance. If Iowa decides to disallow food assistance, if a custodial parent does not cooperate with CSRU, the Child Support Recovery Unit, the savings we will see in our state will be 100% federal benefits. There will be no state savings. In fact, there will be state expenditure increase as we will need to increase the number of full-time employees in our CSRU unit in order to work these cases. So we would be trading off federal benefits for additional state expenditures. The last area that we would like to note is that under the existing public health emergency, which is in effect for the entire calendar year, by accepting the enhanced FMAP rate that became allowable with the COVID CARES Act, the millions of dollars Iowa comes with these conditions, such as we are not allowed to disenroll anyone from Medicaid during the federally declared pandemic. So in summary, the current bill prevents DHS from determining what data will be accessible to us through NAC, would prevent us from conducting a cost-benefit analysis through the free trial product that Equifax is offering, and it will result in less federal funds and support for Iowans while simultaneously increasing state expenditures for an income verification system and for costs to support additional CSRU staff. Thank you.
Thank you very much. And that was almost 6 minutes, but that was important information. And I'm glad everybody heard that. Thank you. Next, it would be Sara Throener.
Hi, this is Sara Throener with DIA, and the asset test and pre-verification parts of the bill would affect our agency. We currently have an MOU with DHS to do their investigations if there is a question of eligibility prior to benefits being authorized. So it's I also want to note that I have Fabricio Gonzalez and Melissa Connor on the call or on the meeting. They're subject matter experts from our investigations division, so if there's any questions later, they might be able to answer those. I just wanted to let you guys know that we did issue or submit a fiscal note on this, trying to estimate how many increased referrals we might get from DHS. And our best estimate is that it would require an additional 5 investigators to handle those referrals. That's all I had. Thank you for your time.
Thank you, ma'am. Leslie Carpenter next, and Victoria Sinclair after her.
Good morning, Senators. Thank you for allowing me to testify and provide some context. I am with Iowa Mental Health Advocacy, and I am contacted by families all the time on a regular basis since we went public with our family story of having a son with a schizoaffective disorder. He's 30 years old now, and specifically, I would share this story. We had moved him to Quincy, Illinois to try to seek better services and moved him back to Iowa on November 30th of 2020. Upon returning, we had to reset up services through DHS for SNAP and for his Medicaid. While we were on the phone with them and while the agency was on the phone with them, they were able to look up and verify that in fact he had services in Illinois, verify when those services would end, and be able to set up when the services would need to be applied for in Iowa. They had real-time data. There was no questioning or need to question that they could access that information. My point is, they are already checking and verifying information, and they check it on a regular basis already. And I attended a meeting last year when DHS was presenting in the House to the HR committee. I don't believe that fraud rate was quite that high that was stated by the other gentleman at the beginning of the meeting. I believe that fraud rate was actually a lower figure than 12%. I'd ask the people on here from DHS what that fraud rate is. Our experience has been that there is a huge amount of verification already. Furthermore, I just think it is not something that's fiscally wise or protecting those who have difficulty in applying for these funds and need a lot of assistance from the providers who are already overwhelmed in our state. Thank you.
Thank you, ma'am. Victoria Sinclair, followed by Natalie Veldhouse.
Yep, Victoria Sinclair with Iowans for Tax Relief, registered in favor of this bill. We think it's just simply a government efficiency bill. Instead of having people manually check all of these people's assets and whatnot, like they're doing right now, it automates that process so that you only have to deal with those who are flagged in the system by and large, which should then reduce the workload within DHS. That's our understanding of what this bill does. So we support that. We support that efficiency to try to help our administration do a better job at administering these programs. So thank you for having this subcommittee. I appreciate it.
Thank you. Natalie Veldhouse, followed by Drew Klein.
Good morning, Chairman Schulte. Thank you for the opportunity to speak on this bill today. My name is Natalie Veldhouse, and I'm with Common Good Iowa. We have several concerns about this bill, namely that this bill will cut off families who are eligible but face barriers in reporting. It also sets up complicated hoops for families to jump through, in particular, the 10-day time window that is needed to respond to written notice would especially hurt Iowans whose primary language is not English and will need time to get help translating important documents. 2 states that have passed similar legislation in 2017 and 2018, Mississippi and Oklahoma, respectively, have not moved forward because of implementation challenges and difficulties squaring the bill's requirements with standing federal law. All in all, this bill is a costly way to take food and doctor's visits away from Iowans during a pandemic, no less. Thank you.
Thank you, ma'am. Drew Klein, followed by Rita Carter.
Yeah, I appreciate the opportunity to speak and don't have a whole lot to add. I think we're certainly registered in favor as Americans for Prosperity here in Iowa, in large part due to both the efficiency pieces that were noted by Ms. Sinclair, as well as Scott's comments on the findings that we've seen from other states that have implemented similar programs. The reality is this is a way to streamline the verification checks that are already taking place, make those more automatic so that they can happen more often. And I think the effect of that is we actually end up elevating and restoring public trust in the welfare system. We want those who are eligible for welfare to be able to access the programs, but just as importantly, we want those that are not eligible for the programs to not be receiving those benefits as well. That is both a government efficiency and a trust in government issue. And so for those reasons, we're supportive of the bill. We certainly ask that you move it forward today. Thank you.
Thank you. Rita Carter, followed by Freedom Malik.
Hello, I'm Rita Carter with the Iowa United Methodist Church. We are registered or declared in opposition to this bill. And we come to speak to you from a faith perspective and have great concerns about this bill. Our John Wesley, the founder of Methodism, had this to say: one great reason why the rich in general have so little sympathy for the poor is because they so seldom visit them. Hence it is that one part of the world does not know what the other suffers. And there are people in Iowa suffering, and this only adds to that suffering. We call on you to not advance this bill. It is mean-spirited, and it's couched in nice words, but it attacks the credulity of our institutions. It attacks the people whom these institutions serve. Thank you.
Thank you, ma'am. Freedom, Malik, and then Luke Elzinga.
Oh, thank you. Good morning. My name is Freedom Malik. I respectfully disagree with the senators and other experts when they say that the identification verification and location verification are necessary here. I am a humane policy volunteer with HSUS, and I believe that eligibility is not an issue. This is not a people issue in general. This is a food issue. On top of the limitations this new system would put on non-technology savvy people, non-English speaking people, it brings arbitrary assets like number of vehicles into the equation that has nothing to do with how much people need help, nothing at all. I don't mind personally as a taxpayer and a concerned citizen and a voting constituent if any of my tax money goes to give people food. And that is because 30 million pounds of food were thrown out between 2018 and 2019 here in Iowa alone, and that was just from our school systems. It is one of the largest, if not the largest, portion of organic waste in our municipal landfills. Between 20 and 30% of our garbage is food, and it's not rotten food. It's not even old food. I've seen it for myself. Our food production just keeps increasing. There's no shortage. The money spent from food stamps goes to pay people to eat this food. It helps. It just helps. Food that would otherwise get thrown away. So I do not support this bill, and I would ask that you do not support this bill. And I thank you for your time today.
Thank you for joining us. Luke, followed by Renee Schulte.
Thank you, Senators. My name is Luke Elzinga. I am the Communications and Advocacy Manager at the Des Moines Area Religious Council and the chair of the Iowa Hunger Coalition. And I'm here today to speak in opposition to this bill, and I'd like to focus the majority of my comments on sections 2, 3, and 6. Section 2 is the piece that establishes an asset limit for food assistance. So this would change current Iowa policy in this regard. We do not have an asset test. Households would face an asset limit of $2,250 per household, $3,250 for elderly or disabled households. But I think the more worrisome piece of this is that households with more than one vehicle could be at risk of losing eligibility. There's an exclusion for one vehicle per household, but for households with more than one vehicle, that second or additional vehicles would go toward that asset test. And especially in rural parts of the state, a vehicle can be the difference between finding employment and not. And so we have concerns about that asset limit and specifically the vehicle allotment there. On section 3, this is the cooperation with the Child Support Recovery Unit eligibility piece. We think that child support payments can be really helpful for SNAP households. Something like 1 in 5 SNAP households with children currently receive child support payments. But we don't think this is the way to go to increase that. SNAP already encourages an incentive to pay child support payments through a child support deduction when you're calculating the benefit amount you receive for food assistance. And I want to note here that this would disqualify custodial parents from receiving benefits if they did not comply. The code reference there on line 10 on page 4 refers to custodial parents. So what we're talking about here is actually forcing custodial parents to comply with child support. It would force them to establish paternity. We think this is an onerous piece. We don't feel like there's much evidence that this would actually increase child support payments. There's a number of reasons why people choose not to have formal arrangements. They may have informal payment arrangements. Sometimes there's issues of domestic violence. So we don't think this is really the way to go. And actually want to point out that the National Child Support Enforcement Association opposed a measure in the 2018 Farm Bill that would require all states to implement these cooperation requirements. So I want to point out that that national association does oppose these types of measures. Finally, want to get to section 6, the identity authentication piece. Now, USDA FNS does give states the option to implement identity authentication. They released some guidelines in August 2019, but the guidelines clearly stipulate that states choosing this options must ensure that the use of an identity authentication process must be an option, not a requirement, and that any applicant has the ability to opt out from this, and opting out does not negatively have a consequence on their eligibility. So the bill as it is currently written, we see does not really align with these federal regulations around identity authentication for food assistance. Finally, I just want to note at a time when we're seeing increased levels of food insecurity across the state of Iowa, we should really be exploring ways to increase access to food assistance benefits, not creating more barriers and kicking people off programs for which they're eligible for. I was honestly hoping not to see this bill this year. I'm saddened but not surprised to see it introduced once again. I urge you to reject this bill, and furthermore urge each of you on this subcommittee to visit a food pantry in your district and take some time to listen to the people facing food insecurity that you represent. And thank you for the opportunity to speak on this bill.
Thank you. Renee Schulte, followed by Denise Rothman.
Hi, this is Renee Schulte, and I am here today to represent NAMI Iowa and to represent the Iowa Mental Health Counselors Association. And both of these clients opposed this bill. In general, we are always opposing any kind of legislation that makes it more difficult for our clients and our members to get the services that they deserve and that they need. For persons with mental illness or behavioral health issues like substance use or disabilities, the paperwork requirements that would be here would be a burden to them, to the point that many end up rolling off the rolls only to have to be turned around and re-enrolled again. I don't think there's been a lot of thought put into the cost that it's going to incur the state with employees and others just for that re-enrollment process that will happen if we have folks that are not able for various reasons to reply to paperwork demands on a timely way. And so we were opposed to this bill last year for that same reason, and we oppose it again this year. Also, hearing what DHS had to say at the beginning of the meeting, if they already have a real-time system in place and have an option for another one that would cost the state nothing, I'm very confused as to why we would want to move forward on such a request as this that would cost so much more in the human services system, when we all know that the cost of the COVID virus and the derecho of this last year, we need all the money in the Medicaid and DHS that we can get to serve the people that we need to serve. And so I'm very confused as to why we might be needing this bill at this time. And I do recommend that the subcommittee opposes this bill. Thank you.
That would be Denise Rothman, followed by Anthony Carroll.
Good afternoon. Thank you, Senator Schultz, for the opportunity to speak on this bill. I'm Denise Rothman with the National Association of Social Workers Iowa chapter, and we too are filed against this bill for many of the reasons that have been stated previously. But I'd really like to build upon three of those speakers. What Leslie Carpenter had to say, specifically a great example of what happens when folks with disabilities need to move, and her insight into how the system is currently working was certainly helpful. So thank you, Leslie, for bringing that up. Also, I want to lift up what Janae Harvey from DHS said, and building upon what Renee Schulte just said. If we already have a process in place or are working towards that process, it seems to me that what Janae outlined that DHS is going to be working on seems like a very, very sufficient process. And so we feel that in order to ensure that the folks who are getting the state benefits, including SNAP or Medicaid or FIP, are the folks that need it the most, it sounds to me like DHS has a great process in the works and that we should just continue down that route. Thank you so much for your time. I appreciate it.
Thank you. Anthony Carroll, followed by John Boller.
Thank you, Senators, for the opportunity to be heard. I'll try to be brief and not redundant. AARP will register to oppose to it, first for overarching reason of access to, the lack of access, something I deal with and our organization deals with quite a bit right now. Number of older Iowans who lack access to computer, who rely on their phones, and yet also are being counseled by us, Attorney General's Insurance Division, don't pick up your phone all the time too. So there is a real issue of risk of making sure people who will be eligible for these benefits are being able to access required paperwork in a real time and efficient way. So that's overarching. Then I'll be specific on page 4, and I think I raised this last year. It's still looking for a definition on page 4, lines 28, 29, where it talks about utilizing the system to access when it will look at eligibility periodically between eligibility redetermination. So again, how do you define accessing it periodically between eligibility redeterminations? Who does that apply to? Is it done by people? So again, looking for some type of definitions or clarity if this were to move forward on what periodically between eligibility redeterminations means. And then last but not least, I'll be specific to page 8. Similarly, a definitional question of the questionnaire having knowledge-based questions in terms of for determination. So again, being specific to those areas, and I appreciate this opportunity to be heard. Thank you.
Okay, thank you for that. John Boller, followed by Stacy Frelund.
Thank you, Senators. My name is John Boller, Executive Director of the Coralville Community Food Pantry. We provided assistance to more than 3,500 Johnson County residents last year. I'm here to speak in opposition to the bill. More Iowans than ever before are turning to our food pantries, our churches, and our private nonprofits for help right now. These private entities do not have the capacity to be the sole safety net for our neighbors. Public assistance programs are critical in getting Iowans the extra help that food pantries and churches simply cannot provide. This bill will cause more families to suffer and place more burden on food pantries and churches. You can help families, you can help food pantries, and help churches by disposing of Senate Bill 1125. And as Luke noted, I urge you to please visit your local food pantry and actually talk with professionals on the front lines and the families who are struggling before you establish any further barriers. Thank you.
Thank you for being here. Stacy Frelund, followed by Amy Campbell. And that would be our final hand after Amy.
Hi, thanks, legislators. Stacy Frelund, I represent the American Heart Association. Right now, we are registered against this bill, mainly because we really feel that Iowa could do more right now to help families who have heart and stroke conditions with their family members and be removing barriers to public assistance, because people really need access to health coverage and food right now as they become sick during the pandemic. Public assistance programs can help these working families right now. And the health impacts of the coronavirus and the economic impacts of this crisis are really being felt in our communities. And in these tough economic times, when people lose their jobs and need help, that public assistance is there to make sure their health needs are met. Access to public assistance programs will help workers who lose jobs to still get affordable health coverage so they can stay healthy and be ready to work again after the crisis is over. Access to Medicaid will help workers hit hard by the coronavirus and those on the front lines of this crisis. Those who work at grocery stores and pharmacies, home health workers and nursing homes, front office staff at hospitals and health clinics, these are often the workers who are uninsured and on public assistance. It is not right that the same individuals who are risking their health by staying on the job may be the ones to suffer the most. Not everyone affected by the coronavirus is affected in the same way. People with low incomes, working low wage jobs, and disproportionately living with chronic health conditions like heart disease, and those who face more barriers to healthcare, many of whom are people of color or live in rural areas, are being hit harder by the coronavirus. They are getting sicker, are more likely to receive bills for care they cannot afford, and are more likely to lose their jobs as a result of this crisis. So we urge the subcommittee members to really think through considering moving forward this bill, because it is something that's going to really impact a lot of the families and patients that I work with. Thanks so much.
Thank you. And Chaney Yeast has her hand up.
Hi, Senators. Thank you. And I don't want you to forget Amy. I think you had her in the queue before me. Oh. So make sure you go back to Amy Campbell.
Thank you. I won't leave her out.
Chaney Yeast, Blank Children's Hospital. We are registered in opposition to this bill. I know this is something you've been looking at for a few sessions now. I just want to add to the conversation from the hospital perspective. I feel like this is really not looking at the additional barriers that we are creating for families to access assistance at a time where there's more need than ever before. So, for example, DHS and DIA talked about the additional workload this potentially adds to them. But to piggyback on what some other public providers have said is that this is going to impact our staff as well. So since the pandemic started, our social work staff at hospitals, and I know it's not unique to Blank Children's Hospital, I'm sure this is occurring at your local hospitals as well. Our social work staff has been inundated with requests of families struggling financially, and they don't understand the application process, or they get a letter from DHS saying that their assets are being checked, and they don't understand what that means. And so it's additional time on our staff's part to help them sort through that, collect the appropriate financial information that they need, because many of these families are not financially literate. They don't understand what these documents are that they need to provide. And so if we're adding additional times during the year for additional checks, that's going to create more hardship on the family, but also on the different service providers in the community that help those families navigate this complex system. And the one last thing I do want to add is Stacy hit upon this. We really have a tale of two economies in our state right now from the pandemic. We have families that have not seen really much change in their economic situation. And yet we have families over the last year, farm families, small business owners that have spent down all of their savings in order to provide the basic needs for not only their family, but for the families that work for them. And so putting these additional barriers to public assistance right now just seems to be an additional hill for them to climb when they're already struggling so much. So thank you again for your attention and consideration.
Thank you, ma'am. And Amy, I am sorry, I did not mean to leave you out. I only saw one hand up there at the moment. So Amy, please go ahead.
Thank you, Senator. And as always, Chaney said it better than I could. I always hate going after her, but I'm kind of glad I did anyway. So thank you for letting me speak. I have a number of clients opposed to this, but I'm going to speak from Iowa Primary Care Association, which are the federally qualified health centers around the state. They have navigators that work with families to determine what kinds of services are available to them. And it is very, very difficult for them to come up with the paperwork sometimes that are needed. So a couple of things that were previously mentioned, as Chaney mentioned, there is going to be an impact to the provider who is going to have to try to help these families stay eligible for their services when we know that they are eligible for them. And the second thing is with what Anthony Carroll had mentioned before on the periodic reauthorization and redetermination. There's some concern about how often that's going to be and how often we're going to have to continue to help families be able to access the services that they deserve and qualify for. I don't think there's anybody on this call that is opposed to the idea of creating a system to make sure those that are truly eligible for the services get those services. And it sounds like DHS has a process in place. What we want to make sure we don't do is add extra expenditures on the administrative side in order to find some savings on the other end. If the greater ability we have to make this more streamlined with it, which is what I think DHS is trying to do, the better. We just want to make sure that we're cognizant of the additional burden you might be placing on providers who are already having that burden with the Medicaid and the extra paperwork required with the MCO process. So I appreciate your time and listening to it. One thing I mentioned last year was that the household income seems to include teenagers' income, like if they're earning money for college, it does not exempt college savings accounts. And so I know we talked about that last year, that there's a concern that it might be you don't want a kid accidentally putting their parents over an income guideline because they're saving for college. So thank you very much.
Thank you for pointing that out. I remember talking to you about that. Good deal. Thank you. And we have Leslie Carpenter for the second time, and that is okay. I just want to make sure everyone speaks once first. Leslie, go ahead.
Thank you. I wanted to go back to address one point that I recall being talked about last year on the Senate floor when this bill came to the Senate floor for debate. Somebody made a comment that all the people that were opposed to this bill would have some reason to financially gain from things staying as they were. I wanted to point out how deeply offended I was sitting in the gallery listening to that comment. There are many wonderful organizations being represented here who do not have any financial incentive to see things remain as they are. I would point out the fact that most of these people are probably underpaid in the professions that they are in, but they are doing it out of the goodness and kindness of their heart. So I would strongly like to make the point that the people registered against this bill are not doing it because they're financially incentivized to have things stay as they are. They are doing it to try to help people that are in need in our state have access to the services and assistance that they need, especially now during this pandemic. Thank you.
Thank you. And then Deanne Cook has raised her hand.
Thank you, Senators. I just wanted to follow up on Deanne Cook, United Ways of Iowa. I just wanted to follow up on Chaney's comments and offer a tool that I will send to the three of you on the committee after this call. United Way completed a COVID financial impact survey where we surveyed 3,000 Iowans about their financial situations before, during, and since COVID. And to Chaney's point, we have a lot of newly needy. We know this through our 211 service, and we know this through the survey. We have a lot of people that are struggling right now that were financially self-sufficient going into COVID, but are now trying to get back on their feet. So about 50% of Iowans who have less than $50,000 of annual income don't have a month's reserve. They can't cover their bills for a month. So that's a lot of families making less than $50,000. When we put limits on encouraging them to save for emergencies, when we put limits on them for vehicles that they need to get to work, we're going to keep them trapped in SNAP. So it's not going to be a dip into SNAP and a bounce out of it. It's going to be a drop. So we really need to think about how we're impacting those who will not stay in this category for long, but who are there now. So I will provide that report to the three of you on the committee as soon as the call is over.
Thank you. And Senator Mathis, you read my mind. We have 10 minutes left. And I was just thinking that this had to be the final speaker. Would you like to go next, Senator Mathis?
Yes, if I could. Thank you very much. Senator Schultz, I'm looking at this bill and I understand that you want to bring efficiency and effectiveness to the public assistance. Actually, the title says oversight, right? But I'm not sure that this bill gets there. I'm not sure it's going to do what we need to have done in the state of Iowa. So I heard some things that were really helpful along in that swim lane, along that line, and especially from Janae Harvey at DHS. And so I would have hoped that you would have had conversation with her prior to writing this bill or filing this bill to find out this very helpful information. And so when Janae talks about the NAC and the National Accuracy Clearinghouse, and that they developed a pilot, and now we could certainly be part of that as it progresses, with not worrying about coming up with money out of our funds, that would be Fed funds. That would be terrific if we could do that. And her comments about Equifax and how they've been working with that and disproven some of the things that we think are wasteful. And she's saying actually by maybe trying to do more verification, that was that didn't always pan out to the theory. So one of the things now, just to be clear about verification, I looked up and I called a couple of providers who help people in this way. And there are 13 questions in an assessment that they have to answer. Adults in the household, 65 or over, how many children, how much money do you have before taxes? Did all the people in the household get the last month, including Social Security, child support? Are they US citizens? Do they have legal documentation to stay? And then they also, under the income eligibility verification system for Iowa, there's a clause in it that says any information available through the system will be requested, used, and may be verified through collateral contracts if discrepancies are found. This information may affect the household's eligibility and level of benefits. And they added the Social Security number under the Food and Nutrition Act of 2008, but also on top of all this, there are pink and green forms. And so the pink form is 11 pages, and it warns that any misinformation is under penalty of perjury. So that's, that alone, warns the person if they're lying or they are ineligible, that they can be in big trouble. So again, Social Security number, people in the home, criminal disqualification, expenses, incomes, resources. And then the green form, food assistance questions, shelter and utilities, and medical expenses it even asks about. I just think that this bill really duplicates a lot of what DHS is already doing and trying to get better doing that and trying to be more efficient doing it with the NAS idea. We did do a fiscal note last year, and there was a multi-million-dollar cost to this IT system. The feds have also said that no one will be removed from federal assistance until the end of this year. And so if your estimated cost savings or maybe a timeline that is kind of indicated in this bill, it could differ a lot. So that would certainly need to be checked. Also, we had a derecho in eastern Iowa, and oh my gosh, no utilities, refrigerators went belly up. You couldn't cook in your own home, no air conditioning for many, many days. For some people, it was beyond 30 days. And so we had a lot of pop-up food pantries come up, and a lot of people had to do replacement costs with their food. Not only were they affected by derecho, but they had also been unemployed because of COVID. So you had two very different things collide. And we saw a number of people who had never been on food assistance ask for food assistance. And that's when it works the most. It was a lot of paperwork. We had long lines. DHS came out and they did their yeoman's job in helping people get food. And a waiver was even asked, of the federal government if we could add extra assistance on because of the derecho, and it was granted. The mayor of Marion walked up to me. They had a pop-up food pantry in downtown Marion. He said, I had no idea there was this much need for food. HACAP was a huge, just did a huge effort in our community to distribute food that was coming in not only from donations, but they were buying food and trying to buy items, like vegetables, perishables, that people could still use and still cook and get around that no electricity. So even beyond the day-to-day task of trying to help people get food assistance and perhaps sign up for SNAP, there are also times where it weaves, in with disaster. And I can't imagine the obstacles that a third-party verification system would cause to something like that. DHS was very nimble in getting this set up and really knew, all of the efforts to try to do that. So I would ask you, for that very reason and all of the other reasons that I've listed, that we don't move this bill forward. I think DHS is well on their way to putting together a better system.
Thank you, Senator Mathis. Due to some, technical difficulties, Senator Whiting's microphone isn't working. He sent me a message he'd like his closing comments. And he said, this is in Senator Whiting's voice. I will sign off on this bill again, as I have in past years. Similar arguments in opposition I've heard in the past is, number one, we're already doing this, so the bill isn't needed. And then versus number two, this will add so much burden to applicants, we shouldn't do it. Well, it can't be both at the same time. Program integrity is important. I've heard from one individual that the fraud rate is north of 12%, and one suggested it isn't, but couldn't provide a number. That we are splitting hairs over a percentage point is not the point. We have significant fraud and we need to address it. Using real-time data analysis instead of manual checks is smart policy. This isn't about kicking people off of programs. We need to make sure that limited resources are used for those in most need. And that closes his comment, and I'll move to my own. I'm going to go ahead and sign this bill out also. I do appreciate, once again, we did hear some points that notes have been taken, and there will probably be an amendment in committee or on the floor if we go there. Underlying all of this, and I guess I'm challenging the media to provide at least both sides, but if you read the bill, it does not give third-party vendors any opportunity to kick anybody off. All it is a tool, a high-tech, efficient tool for DHS to scrub the eligibility, the lists of recipients, and find those who don't fit in. If they don't fit into on the first look, they're not kicked off at that point. That only gives DHS the opportunity to manually check them, as opposed to checking the hundreds of thousands of people that they're checking right now. I believe that 85 to 90% of recipients would slide through this system, probably without providing documentation or supporting documents, simply because these eligibility checks could do that for them, and it would actually make their experience easier, and then focus all of the energy only on the 10 to 15% who have a flag come up. Most of those will probably be moved through into the system as well. So this bill doesn't change the standard to get in. If DHS, due to COVID or the derecho or any other emergency in the future, decides to lift or lower, however your perspective, if they want to make it easier to get into the system, this bill does nothing to that. If they want to waive somebody and let them in the system anyway, it doesn't do anything about that. We're going to go ahead and move this out, but I would challenge at least the public information to be accurate as to who is still deciding who's in our eligibility or in our systems, and that would be DHS. This is only a high-tech tool to allow them to do their job better. So with that, I'm going to go ahead and close it out. It's 12:30, and Senator Mathis, you actually have a subcommittee immediately now, so we're going to adjourn so they can use this screen. Thank you, folks.